Welcome everyone to the 6th annual Idaho Parent Network Workshop. We are pleased to have you join us for, okay, long title here, what we know, where we are, and where we want to be, understanding the 2021 Yes Family Survey results. Before we get started, there's just a few housekeeping items. If you have questions throughout the session, go ahead and put them in the Zoom menu bar. And in the coming days, we will be posting this the session to our website, which means that we will be able to look at it later. Please share it with anyone you think it will be helpful for. If you have questions, make sure you put them in the chat or the Q&A. We'll be monitoring them, and we look forward to this conversation. So I have joining us today, Dr. Nate Williams, who I just adore. We have so much fun talking together, and we're going to talk about our survey. So go ahead and take it away, share your screen, and away we go.
All right, thanks Laura for that intro. I'm excited to be here. So I'm going to do share screen, which should just take me a few clicks. And, now my...
You started, there it is. All right, I see your whole slides. Go ahead and share your, and make it big screen, because now we're seeing all your slide deck.
There we go.
Yay!
Got it? Good.
Yes.
All right. Well, good. Well, it is my pleasure. As Laura said, my name is Dr. Nate Williams. I'm from Boise State University. Please call me Nate if you do call me anything. It is my pleasure to present the results of the 2021 Idaho Youth Empowerment Services Family Survey. So I'm not going to belabor acknowledgments other than to say I get the pleasure of presenting these results to you all and talking with Laura, but there's a whole crew of folks that are involved in this work. And so I just get to present it, but really a lot of good people involved, including and importantly, family members who are involved. Some of you may know Jen Griffiths and Guida Guintini, who actually both of them have just recently moved, which is kind of heartbreaking, but they are family representatives who have been really instrumental in this work for quite some time and in many other ways within the system. And so we were grateful to have their participation with this. The other thing that I'll just add about this is that so actually, and this kind of goes to my next slide of why do we conduct the survey. So a little bit of context for folks. So this is a survey that is commissioned by the Idaho Department of Health and Welfare, the Division of Behavioral Health. They are the sponsor of the survey. They fund the research project, and they contract with me and with other folks at Boise State University to do that. So we're really working, Boise State's job is really to kind of help the department do the survey that they're interested in doing. The big goal of this survey, of the family survey, is really, it's about quality and about effectiveness of services from the perspective of families. They really view this as a way of bringing family voice into the evaluation of the system. And so there's lots of activities that the department does to evaluate quality of care, and this survey is just one of those things. And the role of this survey is really to give that bird's eye view, to get that statewide sort of population representative picture of families' experiences of care within the YES system, the Youth Empowerment Services system, and also families' perceptions of outcomes. So that's really the goal. And when I say the Youth Empowerment Services systems, that basically just means the child mental health services that are delivered all across Idaho to kids that need those. So that's the role of the survey. The goal really is to monitor the quality and effectiveness of services over time. So this is the second year. Actually, this is the third year that the survey's been done, but I don't really count the first year because it was with a sort of a small pilot group. This is the second year that the survey's been really done at a full statewide scale. And you're going to see as we go through results today, I'll talk about results from last year when we did similar thing and results from this year and how that compares. And the idea with this survey is that we'll continue to do it over time. With that, obviously, there's value in having similar questions, the same questions over time, so you can track how things are going, whether things are getting better or worse. But the survey is meant to be a living document. There really is meant to be room for, if we're not assessing something in the survey that we should be assessing, to be able to add things to it or be able to change things to it. Toward that end, I want to encourage folks who are in this session, if you have thoughts and ideas and feedback about areas that you think might be worth assessing in the survey, please share those. You can share those in the chat, and Laura and the Parent Network folks will share those with me. Disclaimer, I do not get to decide what goes into the survey. As I said, that's the department's purview, so I can't overstep my bounds. But it is my job to bring to them things and say, hey, I think this is important, and I certainly welcome your feedback. And I know actually the department welcomes feedback too. As you think about what might be added, what might be helpful, you know, well, as we go through, it'll probably stimulate some ideas for you.
And
so
in full disclosure, Nate always knows what I think about this. I give you plenty of feedback.
True. Lori is good feedback. A lot of people do. That is true. Actually, that's really good. And then the third piece that I would like to mention here is that the goal of this survey is to identify targets to improve, right? This is not, oh, let's all just pat ourselves on the back and say we did a great job. That's preposterous. Really, the goal is to say, okay, what are the areas of strength, if there are some? What are the areas of weaknesses, and what do we need to do better? And I want to tell folks, this data gets looked at by policymakers and decision makers. I've been in calls the last 2 months presenting this data to statewide groups with high level folks at health and welfare, and they're looking at this data. It certainly isn't the only data that they look at. They look at lots of things, but folks that have decision-making authority are paying attention to this. And there has been good feedback we've gotten already in the 2 years we've done this from families, and there's been changes made to the survey, and that goes into informing what kind of priorities do we need to work on. So really, I again, just to kind of encourage that feedback from folks that we want this to be a worthwhile thing. So, all right, I'm just going to plow ahead. Yep. So what's in the survey? There are 5 broad topics that are addressed by the survey that we ask families about. All of these really are about families' experiences of care, as I said, or their perceptions of the outcomes of care. So the first one you see there is what we call YES, Youth Empowerment Services Quality Indicators. So what those are is all the mental health services for kids in Idaho are supposed to be delivered following a certain set of principles, things like strengths-based, right? That you're bringing in the strengths of the child and the family and not just focusing on problems and needs. Collaborative and team-based. So if there's multiple folks that are involved in working with a youth, both formal, like maybe schools and maybe juvenile corrections or mental health people of different kinds, whatever, those kind of people, as well as informal. There's family members, there's extended family, there's all kinds of people involved. The idea about collaborative and team-based is that all those people should be working together in a coordinated way, which does not always happen, as Laura and others can testify to. So there's these certain principles that are really supposed to guide care for families in Idaho for children's mental health. And so we ask families a set of questions that are basically asking, do the services that you receive, are they meeting these principles? Are they in alignment with these principles? And we call those the quality indicators. And on all of them, they're positively worded so that if a higher score is better, right? Yes, if they agree with that, it means that their care was provided in accordance in the way that we hope it will be provided.
And I think it's important to know that the principles of care and the practice model that exist for youth empowerment services were actually written by parents. And so it's not just the state of Idaho saying these are the, the magic little unicorns we're going to try and have. It was actually a collaboration with parents and the state to come up with those principles of care and the practice model. Part of it was the foundational documents of youth empowerment services that stem from the original lawsuit, but how they were fleshed out, that really was an intense collaboration years ago now. And so when you're asking those questions, you're really asking, how well are we doing on the things you told us you wanted done? So they're not random things. They are very intentional, and they were definitely selected by families, obviously in alignment with what the criteria that they needed to hit with the settlement agreement. But the wording, the choice of how to do it, that was very much parent driven. So I think it's important that we know that those questions are really following up on what we asked the state to do. And when I'm looking at your other topics here, crisis and safety planning, that's a big one. And I'm looking forward to talking about it. We actually just came out of our crisis and safety planning workshop session. But the Kansas assessment, that is one of those things that is the great unknown. It's kind of like Sasquatch. Everyone knows it exists, but we don't necessarily know what it looks like. People who have done it well can give you great experiences, and the ones who haven't aren't really sure what we're talking about. And so I think it's going to be valuable to see those. But the youth and family outcomes, I kind of chuckle at that because as long as my family is still alive, I'm not sure we're done with our outcomes yet. So I'm going to say snapshot of outcomes might be a better thing, because my family's still going, and so we don't have an outcome. An outcome sounds like we're done. Right. But I think we were going for what was the result of this, this thing you were doing, and then those services. Those are also Sasquatch in some parts of the state services.
It's true.
There's mythology behind it. We've heard of it happening, but some of those families would ask you to take a picture of the services and mail it to them.
That's right. Yeah, very good. Thanks, Laura, for jumping in there.
Well, so, I just laugh because you look at all of those things, and our families are like, wow, you guys think of those as separate things? I think we think of them as just one giant blob of care.
Exactly. And that's what they really are, right? And that's an important piece of it. So that's really the goal, is to assess families' perceptions and experiences across these 5 areas. And we'll go through and you'll see more in depth sort of how we operationalize this stuff. Really quick, just wanted to highlight that one of the areas of indicators that we said we assess were those YES principles, which Laura pointed out. Thank you for highlighting that, Laura, that came from families in large part, about what are the YES principles that should be driving care. And so one of the things that we did last year in the survey was, it's fine to make up a set of survey questions and say, okay, we hope these things are assessing the YES principles, but it's another thing to sort of have actual evidence that that is the case, and that there is empirical evidence that you're actually assessing what you're hoping you can assess. And so I just wanted to highlight, this was an article that we published based on the results of the survey last year, which provided some good evidence that the items are reliable, they are valid indicators of the extent to which families are experiencing those YES principles in the way that we hope. I want to highlight on here, I don't think I underlined their names, but Guido and Jen's names are on that author byline there. Guido Guintini and Jennifer Griffiths. Those are the 2 parents that helped us. So again, just underscoring, like, this really is supposed to be a family involved process from top to bottom. And so it's really been a joy to work on it, actually, because of that. So let's talk a little bit about the survey itself. So the target population for the survey in our wild fantasies is we want to learn about the experience of all the Idaho youth who participated in YES services, basically in the second half of 2020, from July 1st, 2020 to January 27, 2021. That's our goal. We want to learn about the kids who are living at home. That's an important detail that I'll talk about a little bit more later. So these are not kids that are currently in a residential placement at the time of the survey, but they're the kids who are living at home. And then we have to kind of be realistic about how are we going to contact these people. So it gets narrowed down to the kids who have had a CANS completed. And so, as many of you may know, in Idaho, the CANS assessment is supposed to be sort of an entry point into services for families. And
CANS stands for Child and Adolescent Needs and Strengths, for those families who do not know what it is. And It is a communication tool that allows families to share their story, but it also assists in treatment planning and determining level of services that are appropriate for the needs of that child, using the strengths of the child and the family to improve the quality and efficacy of care. So that's why the CANS is a nice thing to pick to do this, because it grabs the families who are starting at the process, and it would grab every child at every level of need. And so it's not just picking high needs or low needs. It's going to be just anyone who's having psychiatric care in the state of Idaho through Youth Empowerment Services system of care.
Right, exactly. Thank you, Laura. That's a really good description. So that's the goal. That's the target population. And when I say that, when we think about the results of our survey, that's really the group we can at best generalize to, right? So that leaves out some people, right? There's people in Idaho who need mental health services who've never had a CANS done. This survey isn't telling us about them. So there's, it's always important to be aware of what's in and what's not included. And those are important issues as well. But we are hoping to represent this group of kids. When we pulled the sample for the survey in 2021, that group of kids, the universe who met that criteria, there were 11,672 youth in that database in that CANS database for Idaho. So that was sort of the universe of kids that we can at best generalize to. Want to point out right here, when I talk about pulling it, the database and all that stuff, people rightfully so have questions about, wait a minute, you're pulling names? What's going on here? This is privacy and all those things, which is, I'm a parent too, and it's important to me as well. So those are very important questions. And so I just want to highlight the way that we structure this work is that Boise State never has any identifiable information. And frankly, I don't want anybody's identifiable information. So we'll talk more about this later, but the privacy and confidentiality of folks really is very thoroughly protected. The department's very sensitive and aware of that. I'm very sensitive and aware of that. That's all taken care of. There's a lot of protocols in place to protect that. But sometimes I just sort of informally say things and then that triggers an alarm, and like I said, rightfully so. So I just want to mention that. So out of those 11,672 kids that were in that database, what we did basically for the survey, the state pulled a stratified random sample of basically 6,000. You can see it's 5,998 kids there. When I say stratified random sample, what that means, you can see the regions on the map there. What that means is we go, you go into one region, like region 1, and then you pull a random sample. Then you go into region 2 and you pull a random sample. You go into region 3, that's the stratifying. Just means that you made sure that you went into each region and pulled a sample. And what that does is it makes sure that at the end of the day, hopefully the sample we get really represents across the whole state, and it's not just, a bunch of kids in Boise or something like that. So what we do is we say, okay, we need to sample 6,000 kids. So we're going to divide up that 6,000 that we sample. And if region 1 has, 20% of the kids that are in that 11,000 database, then 20% of our 6,000 sample is going to come from region 1. It's going to be randomly sampled from there. So that's kind of how we do it. What that basically does is makes the sample you get, ideally, makes that sample a mini snapshot, a shrunk down snapshot of the whole state, while making sure you're covering everybody from top to bottom.
So quick question, when we're talking about people in regions, are we talking about where they live or where they got their CANs?
Good question. And it is, I actually checked on this, Laura, because you asked me, and thank you. It is based on the address of the youth and family that's in the database. So it's where they said they lived at the time when they.
Well, and I think it's important for us as just in Idaho, for people who aren't familiar with all the regions, that if you live in region 4, you might have a provider in region, if you're in 3, you might be in 4, vice versa, because they have very interconnected community. Also region 6 and 7. And frequently region 5 travels to either region 6 or region 4. So this is where they live, not necessarily where they are receiving services. So it's just an important distinction for some of our data.
Yeah, it is. It is really important. So that's the group that we hope to get, and we'll come back and talk about what we got later. The survey process. So it's a 4-step process. There's actually a lot of research out there about how do you do a survey well. It is a postal mail survey. We mail it to people because that was sort of selected as the most practical way to get to everybody. Not everybody has internet or whatever. Certainly the state doesn't have like an email address that works for every family. So, but they do have an address for folks, although there's problems with addresses too sometimes. But the survey itself is a 4-step process. So families got a letter from the state of Idaho on Department of Health and Welfare letterhead signed by Candace Falsetti, who does a lot of the quality work for the Division of Behavioral Health. And it just basically says, hey, this is a legit thing. This is legitimate. It's a real survey. It's from the state of Idaho. It's really important. We want to hear from you. We want to hear the good, the bad, and the ugly. Like, this really is an important thing. You've been randomly selected to represent yourself and others. Please share your experiences with us. You're going to get a survey in about a week. Then a week later, we send them, families get another mailing. It has the survey in it, has a little cover letter, has a business reply envelope in there. So they don't have to pay postage to send it back. They just drop it in, lick it, and stick it in the mailbox. A week after that, they get a postcard. It says, hey, just a reminder, if you sent your survey back to us, thank you. If you didn't, it's probably sitting on the counter over there. Would you please go pick it up and fill it out and mail it back to us? And I have had people tell me that that's exactly what happened to them. And then a week after that postcard goes out, we send out one final follow-up for folks that haven't replied and say, hey, we really do want to hear from you. Here's another copy of the survey in case you lost it. And here's another business reply envelope. Please share your experiences with us. And
would you help remind my kid to do her homework the same way?
Yeah.
I mean, the pre-homework, the homework, the reminder for the homework, and the duplication of the homework. Right. This would help me. This would help me out greatly, Nate. You could do this all the time.
Yeah. This is like human behavior 101, right? Yeah. So anyway, so that's kind of how it goes. It's funny when you said that too, Laura, because if you track when the things come in, you always get a little bump. Like you send out a reminder, you get a bump, then nothing. You send out another reminder, you get a bump. That's exactly how it goes. So it's kind of funny.
There's a certain class that my youngest could really appreciate this kind of methodology from, just getting her work turned in. I'm all for it. We can talk afterwards about how you're going to start handling her homework assignments.
There we go. So that's the survey process. The survey itself is 1 page. It's 42 questions, which kind of sounds like a lot, but they're like strongly agreed, strongly disagreed kind of questions. So they're really pretty quick. It's just 1 page front and back. And actually, this is a good time to mention, I think we'll provide the link. The survey results are all posted online and you can get those. I think the workshop will provide a link to those. And in that report, the actual survey is printed at the end as an appendix, so you can see exactly what was sent to people if you're interested in that. This is also a good place to mention the privacy and confidentiality. I brought this up earlier. It's a really important issue. Everyone is really concerned about this. I won't go into a lot of details, but other just to say, I don't want people's identifiable information. The state doesn't want me to have it. Families don't want me to have it. Nobody wants that to come to Boise State, and it doesn't come to Boise State. So there's a very detailed protocol in place, and we have to get approval through our institutional review board and all these things. But there's a protocol in place so that as a researcher at Boise State, I never have anybody's identifiable information. What I do get is a de-identified set of data that says, okay, here's a random ID number of some person, 11473. I have no idea who that is. And here's how they answered the questions on the survey. What the department also does with that de-identified data set is they can say, okay, because they can send a link to say 1147, here's what they reported to us on the cans. Here's what they, shared about their child's ethnicity and race and age and things like that. So the department is able to create a data set that can match those pieces of information so we can analyze that. You're going to see actually the results. I think the most important results actually out of this are from some of those linkages, but right. Boise State never has access to anybody's info like that. So really the confidentiality and privacy is an important piece.
Right. I appreciate that. Thanks for letting us know. I'm excited for the data.
Yeah, I know, we got to get to it. So survey response, what did we get back? We did all that work. What did we get back? So we had a wonderful response rate this year. We had 1,185 families. That is an enormous number of Idaho families who shared their experiences with us. And I'm truly grateful for that. The response rate is 20%. That was significantly higher than last year. We only got 9% last year, which I felt okay about, but it really was better this year. And we think because we did better messaging and we did some stuff to make that better. Here's the response rate by region. So you can see there was a little bit of variability by region, but generally from 16 to 26% there. One of the things is if we exclude the undeliverable mail, so whenever you send out a survey, there's always a set of addresses that just are not valid anymore. And if you exclude those folks, the response rate actually goes up to 24%, almost 1 in 4 people we got it back from. So for in today's day and age, you guys all know listening to this, like people are sick of surveys. They don't want to be bothered with this garbage. Like it's actually really remarkable, I think, to get that.
I think most surveys call it good if they get 3% response.
Yeah, it's a big deal. And this number of 1,185 families, 1,185 families, like you'll see nationally representative surveys that have that sample size. So that's really a nice sample for us here in Idaho. So what did we find? First thing here I want to say is that when you get a survey back, the first thing you always do is look to see what were the characteristics of the people who responded and how does that compare to the people who didn't respond, right? Because we select our nice random sample, we're really careful to do all that. But if we get back a really biased sample, if only the people in Boise answered and everybody from region 2 said, forget it, I ain't answering that stupid survey, then we have a biased sample and that's a problem. And our results are what they are, but they're not going to be really representative. So the first thing you do is compare what you got to what you sent out. And I'm pleased to share that based on that, there were no statistically significant differences between the characteristics of the youth whose caregivers responded to the survey compared to the youth whose caregivers did not respond to the survey. I have to say that carefully because it twists my tongue. But basically just showing that as far as we can tell, the folks who responded, really, there was no systematic differences between them and everybody that we sent the survey to. So as far as we can tell, it's a pretty good snapshot of the folks that we sampled. So that's always a positive thing. The other thing we do with this is you can adjust the results, their statistical techniques to try to make it more representative of the population. And I actually did do that. For those that are interested, it didn't even change the results meaningfully in any way, which isn't surprising given what we're looking at here. So anyway, we're trying to make sure that we're representing everybody as best we can. So gonna jump into results. As we jump into them, I just wanna show you, I'm gonna show you a lot of these gauge charts. So I just wanna go through how to interpret these real quick. So the light gray line that you see kind of in the background there, I tried to point to it, the light gray, that is the percentage of folks who agreed or strongly agreed with the item, with the question last year in 2020. So you're gonna see that light gray. Then in the green and the big percentage, you see the folks who agreed or strongly agreed this year. So we're comparing apples to apples. How many people agreed last year? How many people agreed this year? And then the difference you're gonna see, right? The dark gray shows the difference. And then that little number with the arrow shows the difference. If it's a green number with an arrow pointing up, it means more people agreed this year compared to last year. If it's a red arrow pointing down, it means less people agreed this year compared to last year. Spoiler alert, there were actually no red down pointing arrows, which was a little bit shocking to me, but that was the case. There were some that stayed flat. So you'll see that as we go through. But that's how to interpret that. The other thing you'll see is that bright red line there. It's set at 80%. That's a target line. So one of the things that the department has said is, you know, we want to get this to where at least 80% of families are agreeing or strongly agreeing with these items. Again, they're positively worded things. So we want families to be having these experiences. And so if they agree, that's a good thing. 80% is an arbitrary number. It's, you know, we could set it at 100% or 90% or 50%. 80% is just an arbitrary number. It's based on humans deciding what would be a good target. The way I think about 80% is that's 4 out of 5 families agreeing with that, which means 1 out of 5 families does not agree with that. And so for me as a classroom instructor, I oftentimes will have 25 students in a class. If I got 20% of those students not having a learning outcome that I wanted them to have, which would be 5 kids or 5 students in my class, what I say to myself is, okay, if I get 1 student in my class not doing well, maybe there's something at home, it's a personal thing with them, doesn't mean the whole class is off course, right? If I get 2 students, maybe it's those students, 3, maybe 4, maybe. If I get 5 students out of 25 that are not learning things that I'm supposed to be teaching them in a class, then I need to look at myself as the instructor, as the designer of that system to say, what am I doing wrong here? Like something is not right about how this course is designed because I've got way too many people not learning the things they're supposed to learn. So that's how I think about that cutoff, but it is just, you know, it's a rational criteria. It's not a, there's really no scientific way to set a criteria like that. So for those who are interested, the margin of error for the survey was 2.5%, which is a nice, pretty small margin of error because we're dealing with a small population and we had a good response. And then I mentioned all the analyses are weighted to reflect the population totals and to account for the non-response, which really didn't change anything in a meaningful way. So finally, what did we learn? And Laura, can you remind me, when is our session up?
We started at 11:45, so 12:45. Okay.
All right. I'm going to kind of plow through, slow me down and pause me when you want to talk about something.
Okay.
So first is good news. The good news is that from 2020 to 2021, there were actually some statistically significant improvements in families' experiences of care that they shared with us on 4 out of 8 of the YES principles. So here you can see those 2 items from that first principle, which is strengths-based care. So this is the idea that all families have strengths and that those strengths should be used to inform the care and the treatment that they receive. You should build on their strengths. And so these are the two items that we use to assess that. And the good news is you can see there, one of them improved by 6 percentage points, the other improved by 7 percentage points. So those are pretty healthy jumps. And those were statistically significant improvements, which is good. The other thing I want to highlight though, is in that far right corner item, you can see it got up to 77%. That's an improvement. We're really happy, but it's not hitting that 80% target line. So what that means to me, at least, is yay, there's improvement, but okay, there's still more work to be done and still more work to do. And as a system, how can we, support providers and folks to make services more strengths-based? So there's kind of a good and a bad there. The second principle that improved was collaborative care, team-based care. You can see there it improved by 8 percentage points, which is great. But again, it's still not hitting that. We've got basically 1 out of 4 families who are saying, no, I don't agree that my services are really collaborative and everybody working with my child is all working together in a coordinated way. So again, there's a positive improvement, but still room for growth. The third principle where things improved was family and youth voice and choice. So the families having a voice and the youth having a voice and choice in their treatment is an important principle. You can see these indicators improved by quite a bit. But again, we still have an item that's only at 67% of families agreeing with that, which is 2/3, right?
Well,
so
and I think it's important to remember that your child wanting to be an active participant, when they're there to actually get mental health care, I will quote my child who said, adults have really boring meetings.
That's true.
And so while that number is low, and yes, we need to find ways to engage kids, and maybe our meetings need to stop being so darn boring. It's a disappointing number, but it also has to do with a change in how we engage our children in general. And we've asked with the youth empowerment services, we've asked for an awful lot of changes. I think this is one of those changes. I mean, 9% is a pretty significant jump, but I think that we are asking for an entirely new way to engage kids. In fact, in our last session, we were talking about how do we engage kids in planning. It was actually discussed. And one of the therapists said that he has a ball that he throws from one end of his office to the other, and he can tell how the kid's doing by how he returns the ball. And I laughed, and he said, busy hands equals open mouth. And how many times have you been in a meeting, Nate, where the adults in the room were throwing balls around the room, or another therapist baked cookies in the break room, had like a little toaster oven and would cook the little small cookie pieces. I'd go to a meeting like that, wouldn't you?
Oh yeah, heck yeah.
Right. And I think one of those things is we're asking for a significant change in how and so 9% is actually a pretty impressive number, but we've obviously got a lot of room to go. Yeah,
it is. And I appreciate you sharing that, Laura. That's because those are all really, really good points. And I love that connection to the other session. That's cool. Because it matters a lot. And developmentally, right? Like, how do you engage a 7-year-old versus how do you engage a 16-year-old? Like, those are all those things matter. So really good stuff. Oops, I went the wrong way. Then the last area where there was improvement, I'm going to come back and talk about this later because this is an important item, was in this, the principle is called community-based service array, I think is what it's called. But I really think about it as accessibility. Like, can you get access to services you need?
This is the Sasquatch question.
This is one of the Sasquatch questions, yes. So you can see the item, and by the way, I abbreviated the items on these. The items are down underneath each of the gauges, but that's an abbreviated version. I need
There's a bigger question, slides. Yes.
Yeah. But the question here is about, my family can easily access the services and supports my child needs. You can see that improved by 10%. That's great, but still only 71%, right? So almost 3 out of 10 Idaho families saying, no, actually, I cannot get the services that my
and I think we also need to discuss the fact that families don't always know that there's other services available. And if they knew about it, then they might go, well, we needed that too. So the question is, they can only answer for what they know exists.
That's a really good point too. Absolutely. So we're going to come back to that one because that is a really important one. But that's part of the good news, is that we saw some improvements, which was good. The other good news was that the ratings remained pretty high on 2 of the principles. One of the principles is culturally competent care. And last year we had 92% of families agreeing basically that the services were respectful of their family's identity in the various ways that is expressed. And this year it was really high as well. Now
I would be curious to see how our youth feel about that.
Yeah.
Yes, you know what? Because therapists tend to be culturally sensitive to the parent in the room.
Sure.
I would be curious to see how our youth feel, but that's a question for another day.
Yeah, no, but that's a really good point. And that is a good, like, this is the perception of the parents or the caregivers, right? Not the youth. So that's a really good point. The other thing that I always raise here, and this has come out in some of the feedback, is that right now, the survey has only been fielded in English. So it's not available in Spanish. And we did have some families that requested the survey in Spanish this year, which we did not have, which is a significant deficit, which actually I know that the state is working on for next year to get that fixed. So again, it's like, well, maybe there's some good news here, but it's also
for English speakers, we have a great culturally competent workforce. All right.
Right. Yeah, there you go. The other one that was high was family-centered care. So you can see some of the items here about, respecting the parents' expertise about their child, them being the main decision makers, those kind of things. Those ratings were high last year and remained really high actually this year. So that was a positive thing. Sometimes people tell me, Nate, those items are like counseling 101. And I'm like, well, yeah, they are counseling 101, but they're important because if you're not hitting it on those, then that means there's a serious problem. So let's talk a little bit about services. So the one of the Sasquatches that Laura said, we don't assess all services in this survey. It's just too much to do that. So the state has picked a couple of services they want to focus on, and we ask families about that. And so you can see the two services here. We ask families, how many times, if at all, have they received a face-to-face visit from a provider at the time and location of a crisis? It's very specific, like someone came there where you were right when it was happening. And so we ask families whether that happened. You can see that increased from last year, 6% basically of families said they had that experience. This year, 15%. So that was a significant improvement. It's always hard
but out of 100 kids, 85 of them still didn't.
Right. And it's hard to interpret this because not all kids need that. Sure. Right. So it's kind of like, well, and we don't have necessarily data for that. We've tried to think about how we might get at that, but so we don't know. I always say this, it's like, it's good that it's happening more, maybe, but does that mean that more people needed it? We don't know for sure, but we do know that that's where it's
maybe
happening.
A not applicable option on that question would help you weed out the people who didn't have crisis.
Yeah, that is a good point. And that's actually a really good point. I'll come back to that for some other stuff.
I love it. Okay, for those watching, I do have to say, I love that when I make suggestions, he pulls out a pen and writes them down. I don't know if he ever uses them, but it makes me feel a lot better. Someone wrote down something I said. It's fabulous.
There we go. I'm glad that makes you happy.
It does.
That's funny that you said that. I'm going to focus here because I need to focus. I can talk about that for now. The other service that we ask about the state's interested in is participation in wraparound. As many of you may know, Idaho State wraparound's been around forever, but Idaho's been rolling it out over the last few years. And so they're kind of interested in that. You can see the percentage of families who said they participated in wraparound in any way, this is any kind of participation in wraparound, increased from last year about 5.6% to 7.4%. That actually isn't a statistically significant increase. But obviously it is an increase. So
from talking to our families, there are wait lists for wraparound coordinators in most regions, if not all. So families are wanting to engage. It's the number of people who are able to facilitate that wraparound process that is our limiting factor right now from what we're hearing.
Yeah, that makes a lot of sense. And I think that's consistent with because I know the state wants to push that out and it's not getting pushed out. So that makes a lot of sense. So so that's the kind of good news-ish. Now we're going to kind of move into what I think sort of the bad news, opportunities for improvement. This is an item I showed you before about the access to mental health services. You already saw this, that there was a statistically significant improvement of 10 points. That's great. In families saying that they agree that they can access services that their child needs, that's good. But the bad news, as I mentioned before, is that still means basically 3 out of 10, almost 30% of families are saying no. I do not agree with that. I do not agree that I can easily access the services and supports that my child needs, which if one of your system goals is to make sure that people can access services they need, this is obviously evidence of a deficit and a gap.
Did you see any great variation in region, or did you only look at the state overall?
It only looked at the state overall. And it does get a little tricky by region because the sample sizes are smaller. So you start to, so, but yeah, but this is for the state overall. One thing that I point out to people, I always forget I have that little box there, and it's an important box. Sometimes people kind of dismiss, oh, it's just a survey question and people said whatever, blah, blah, blah. Well, I would argue that this is actually an important survey question and the answer is meaningful. And part of the reason I would argue that is because I actually did an analysis with these data and I looked to see, did a caregiver's answer to this question, did that predict the likelihood that their child was psychiatrically hospitalized in the last 6 months? Because we asked them on a different question, has your child experienced a psychiatric hospitalization? How many have they had in the last 6 months? So we were able to like do an analysis where we could see, you know, did people who answered this question, who agreed with this question, if you agreed with this question, was the likelihood that your youth was hospitalized significantly lower? So that was what the analysis was looking at. And the answer to that question is yes. For parents or caregivers who agreed or strongly agreed with this question, the odds that their youth was hospitalized for psychiatric reason in the last 6 months was 2.38 times lower. So 2 times lower odds of having been hospitalized if they answered yes. Now, an important thing, if you, well, but that, you know, there's confounding factors, right? Like how severe is the child's problems and all these things. And that's 100% right. So when I did that analysis, I controlled for everything. I controlled for the CAN score, which is really the biggest one in terms of how severe are the challenges. I controlled for the region that they were in, although you can't tease that apart separately, but I control for that. Control for the age, that's a big factor on whether a child is hospitalized or not. It's the age, race, ethnicity, sex, and how many months they told us they were in services, right? Because some families have been in services for a long time, some have just started. So I controlled for all those things in the analysis, and that was still the result. And when I say I controlled for it, what it means is you're comparing apples to apples. So I'm comparing a kid with a CANS of 3 and another kid with a CANS of 3 whose age is 15 to 18, whose age is 15 to 18. Like everything is the same about those kids. You know, statistically, everything's the same about those kids. The only difference is that this kid's parents agreed they could get the service they needed, and this kid's parents did not agree that they could get the service they need. That's the only difference between those two people. Statistically, it's not an experiment, which is an important limitation, but statistically, the best we can do to compare apples to apples, and people's answer to this question predicts whether or not the youth was hospitalized in the last 6 months. That to me is pretty compelling evidence that people's answer to this question actually does matter, and that access to services, not surprisingly, makes a difference, right? To what's happening. So that's that. The other analysis there was also, we asked about improvement in day-to-day functioning in behavior at school. And the improvement, again, same kind of analysis, was kids improved 27% more when their parents were agreeing with this. So evidence here that people's response to that question matters. Want to drill down on that question a little bit more. So here we're looking at the same question. You can see at the top, my family can easily access the services my child needs. But now I'm breaking out people's answer to this question into 4 groups. The groups are, we have one group where the CAN score for the kid, for the child was 0, which is the lowest level. It doesn't mean they don't need anything. That just means they're at the lowest level. CAN score of 1 is the second group. Kids who had a CAN score of 2 is the third group. And kids who had a CAN score of 3 is the fourth group. CAN score of 3 is the highest level. It means that child and family is dealing with the most severe challenges and really needs that intensive level of support. Now remember, these are not kids in residential treatment. We left those kids out. These are kids living in the community, but they're really at that highest level of need. What you see on the bars there is the average level of agreement with this item for each of those 4 groups. If they're at a 2 or higher, that means on average, the people in that group agreed that they can access the services and supports their child needs. So what you see here is for those first 3 groups, they're all at a 2 or higher, which means on average, the caregivers in that group said, yeah, I agree. I agree, or I strongly agree that we can get the services my child needs. Now, that doesn't mean everybody in that group said that. It just means that's the average. That's sort of the best representation of that group. So that's a good thing. But what you see there on the far right is that for the kids who have a CANS of 3, those are the kids with the most severe challenges and the most significant needs. Their average response was only 1.8, which is not a 2, I'll point out, which means that on average, they did not agree that they could get the services and supports they need. And that little asterisk there means that that was a statistically significant difference. It was significantly lower. It's probably a real difference that they are really significantly lower than those other three groups. So the way I interpret this is, there's some evidence here that maybe for kids with less severe needs, the system's, maybe doing okay about this. But when you get those kids who really are facing the most challenges and those families, there's evidence here that they are not getting that support that they need.
So for people who are not as familiar with the CAN scoring, a CAN 0 is no evidence of a need. It doesn't mean there isn't one. There's just not evidence at this time. And a 3 is that we need immediate action. So a 1 is cautious, watchful, and waiting. And 2 is that it's time to implement things. And 3 is more do it now. Like now we have imminent issues. And right. So what you're saying is the more likelihood that a family said, no, we don't have access, is also correlated strongly to the fact that they are in the, we need something right now, which, I mean, it doesn't take a large leap to figure out that people with the most needs are feeling that they have the fewest access to services, because they would potentially have lower needs if they had the access they needed. Right.
That's true too. Yeah, exactly. So there's really, and when I present these data to folks, a lot of times this does resonate with families, because they, if you have lower level needs, there are things available, you can get some things, but really when you have that significant need, there's a big gap between, oh, I need to see a therapist once a week, and oh my goodness, we're on the verge of residential treatment because things are out of control. And where is the services in that area for those folks? And so that's what I think this is showing. The services are least accessible for the youth with the most severe needs. I was going to say too about that CANs of 0. Thank you for sharing those definitions, Laura. So and I want to say too, I think a lot of times with the CANs of 0, those are kids that have been at higher levels, but they're kind of stabilized. So sometimes people are asking like, well, why is there a CANs of 0? That sometimes.
Well, and CANs, I think also is important that it identifies what's in fact affecting the child right now. So they could have had a massive issue years ago, but they had great treatment. They're in a more stable place. It doesn't seem to be involving impacting their life right now. And there's no evidence that it is triggering a functional impairment. Now, and I think it's important that we identify that. Doesn't mean there isn't an issue. It just means right now we're not seeing any evidence of that issue. And that can change very quickly, which is why a CANS is redone anytime there is a change in the child's situation, or if they're, or on a regular basis, they check back in on a CANS. It's not a one and done assessment. It's a continual communication tool. So at that moment they had a 0. It just means that what is impacting them right now is not, there's no evidence of anything. So, and typically we don't have tons and tons and tons and tons of kids who have 0s,
right?
Because they don't take the CANs. If they don't do the CANs if there's very little evidence.
Need it. Yeah.
And I guess the caveat to that would be if this is a kid that you were following and you're tracking treatment and the treatment is improving, then that would be a realistic and good reason to do that.
Yeah. Yep. So that's the takeaway there. Moving on to safety planning. So I said we asked questions about the safety planning. We have 2 items that ask about safety planning, which you see them here, or actually we have 3 items. You see 2 of them here. One of the things that's important to know on the survey, first thing we do is give folks a definition of what a safety crisis plan is. This was some really good feedback we got that, hey, you should really kind of tell people what that means. Then the second thing is what Laura suggested is we say, hey, you know what? This doesn't apply to everybody. If you don't feel that your child needs a safety plan, not applicable, just check here. It's like highlighted as a column, like just check that and move on. So when you see the percentages here, these are only responses from families who felt that their child could benefit from or needed a safety plan. That was, they had the option to opt out and they opted in and said, no, I think my child could benefit from that. And that's what you see the percentages here. So
I think it's an important thing to know that in the YES system of care, every family who receives mental health services in the state of Idaho is supposed to have a crisis and safety plan developed with their provider. So it's not just gosh, it was convenient on Tuesday, so we had nothing else to do and we did it. this is something that everyone is supposed to have. And I think, and actually, as I said, our last session was about crisis and safety planning. And one of the things that I think is important to note is that there are generic plans.
Mm-hmm.
They usually say something like call 911, and that's the end of the plan, that families may have. There's also some providers who do plans that they don't explain to their families this is a crisis and safety plan, so they don't know what it is.
Right.
And there's also ones that they do it, they put it in their files, and the family doesn't have a copy of it, and so they don't even know it exists. Right. So part of this is a communication issue with your provider. Also part of it is making sure that the crisis and safety plan actually matches your family's needs, not just a generic call 911 or, you know, go to your local emergency room. So of the things that you guys surveyed, I'm going to have to say that this is one of our biggest focuses at the Parent Network. When we originally did a far less scientific survey a couple years ago, and we asked this question, we really came back with 67% of families saying they either had never even heard of it or had didn't think it was anything that had to do with their kids or was effective in any way. So yay for us creeping up towards the other, you know, we're flipping it. We're a third higher than we used to be. But it's still shockingly low. And I think for those watching, a crisis plan should be more, it was more appropriately called the how not to have a crisis plan. Yep. And a safety plan is how to stay safe if in crisis. And so you would think those with mental health concerns would be really engaged in how not to have a crisis and how to stay safe. So these numbers are, to me, staggering, actually. It's not just low, it's, oh my. I'm hoping that this is because we have a lot of kids who are getting care when they have really basic, I don't want to say unimportant because that's not true. They're important, but they're easily addressed or competently addressed already, and they're not escalating. These are kids who are, you know, are well managed and are feeling confident with their care. And maybe that's why we're not planning. Fingers crossed that that's what this is. But my guess is that it's more that families are very overwhelmed, and the thought about adding one more plan and understanding what needs to happen is too much. So I think this actually shows us a culture shift that we need to have in expectations on the family side and how we communicate that as a provider. But also, if you've got a fire in your head right now, you're not planning for the next fire, you're handling this fire. So that may also be part of the problem. If you've got families in high crisis, they're not planning for the next crisis, they're getting through this one.
Right. Yeah, very good. That's really good stuff, Laura. Absolutely.
And I want to make sure no one thinks from what I said that I mean that the small concerns are not important. They're very important. I'm just hoping we're catching them when they're concerns and not crises. And that's what I'm hoping.
Yeah. I think that makes a lot of sense. And you highlighted kind of the different progression we tried to get with these questions, which it's interesting to me that the percentages are so similar. But, you know, were you even helped to make a plan at all? Right. And so we still have 40% of folks saying, not as far as I know, not really. So it's like what you said, well, maybe there's one in a file somewhere, but the family's perspective is, no, that didn't happen. And then the second piece is, well, you might have a plan, but do you actually think it's going to be helpful when you actually have a crisis? And then how confident are you about that? And
well, again, I think it's funny that more people are confident that it's going to be useful than think they have it. Then they participated in it. Yeah. So I do remember being given a crisis plan once, and it was shuffled in with a stack of stuff I needed to sign. Like, you know, here's your annual report, here's your, you know, comprehensive diagnostic assessment, here's our treatment plan, here's your safety plan, sign. Here's a copy, go home. I had no idea what those things were. Right. And so I don't know how much of that is involved here, but I do find it funny that we've got 1% that is confident that the plan that they didn't participate in is going to be useful.
Yeah, it is interesting. It is interesting. And, you know, so this is a good place to say data begins the conversation. It doesn't end the conversation. And so these are exactly the kind of conversations that we hope that this kind of data will trigger. So the other question we asked about safety crisis planning, this came from parent input, was we asked people just yes or no. have you used a safety or crisis plan in the last 6 months? Like up or down, yes or no? And if they said yes, we ask them a second yes or no question, which was it effective? Did it work? So you can see here, 83% of the families said, no, I didn't need to use that in the last 6 months. And then the remainder of the folks who answered the question said they did need to use it in the last 6 months. And then you can see the breakdown there. The top is the percentage of folks who said the plan was not effective. We used it and it did not work. And then the middle bar there is the percentage of folks who said we used the plan and it was effective. From the parents' perspective, they felt like it worked.
For those people who aren't counting all the numbers, that basically is 1 in 3 said it didn't help. Exactly. And that's also a rather horrific number. One of the things we talked about this morning was when you have a plan to practice it when it's not a crisis. So it's hard to know how much of this was the plan not being effective and the people who were trying to implement it not knowing how to implement it in the moment. So, they said, you check your smoke detector and you do fire drills. Do we actually check our safety plan and practice using it? Do we have people who, if they're part of the plan, that know ahead of time they're part of the plan? Or do they just get a phone call? Hey, I need you now. Why? Because you're part of my plan. Or, do parents practice speaking in softer voices and de-escalating? I mean, I know that when my kid's in crisis, I am not the calmest person you have ever met. And have I practiced and have I been given support to do that? So I think that you're right. It's not the end of the conversation. It's the beginning. My follow-ups to these families would be, why was it not effective? Was it call the police? If that was your plan and the police came and said nothing we can do, well, that's a bummer. I mean, but not effective. Or did mom, I'm speaking to myself here, and did mom lose her stuff in the middle of the crisis and it didn't matter what the plan was because now I was in crisis too. And I was, the one who was supposed to be carrying out the plan. I think there's a lot of education that needs to happen on this. And I want to give gold stars to all the people who had effective plans.
Yeah, I know, right? That actually is really good. 100%, Laura, that's great stuff. And really, really, really good stuff. And exactly all the kinds of issues that come into play. The other thing that's come up with this when we've showed this data to folks is, well, you actually touched on this, is do other people who are involved in the plan know, and can they respond? But also, do other places use the plan? I've heard families say, we have a great plan, actually, we feel great about it, but, and we shared it with the school. And then a crisis happened and the school didn't use the plan. And it's like, oh no. So it's really a question of, a lot of different people are involved in this. And I love what you're saying about.
Well, and the plans have to be collaborative. They have to be collaborative, because if you write a plan that says if my kid's in crisis, they get to sit on the roof, the likelihood that the school is going to let your kids sit on the roof is pretty slim. So you need to make sure that you potentially have multiple plans for different locations and different situations with the people who are likely to be at, there. And I realize that we've got a couple minutes and you've got a ton of data. So throw it on me.
Okay, I'll plow ahead. I'm so sorry.
It's me. I'm talking.
It's good. This is good stuff though. And I'll just reiterate, all the full report is available online so everybody can.
And I've already put it in the chat and we will post it on the Parent Network website as well.
Cool. We asked 5 questions about the CANS implementation. I'm not going to belabor this. Laura already did a great job of describing the CANS is supposed to be a communication tool between families and providers, and it's supposed to go a certain way when it's really working as a communication tool. And that's what these items are getting at. And so we asked families, basically, are these things happening, which should be happening? And they could say they agree, they disagree, or they don't know. We told them what the CANS was and what it's about in case they didn't know. But a lot of people, you can see 45% of people on some of these questions said, I don't really know. And we told them, if you don't really know, then just check don't know. I interpret that as kind of a red flag and a problem, because everybody who got the survey has a CANS completed about their child to remind you of that. So like, there's a CANS about their kid in the universe, but for whatever reason, that communication is broken down where they don't feel that they can really evaluate the process of that CANS and the communication that's supposed to happen as part of that. And so that in and of itself can be kind of a signal that, hey, maybe this communication process isn't happening the way that we hope it will.
Well, when your kid gets a report card home from school, everybody knows what it is.
Right.
And you look at it and go, oh, that's an A or that's an F or, whatever, what those things mean. And I think that this is part of our culture of understanding what this communication tool is for. And we haven't quite got to the point that everyone is communicating as well as they thought they were.
Yep, absolutely. So then real quick here at the end, and this is all in the report that you can really dig in if you're interested. We did some analyses to see, was there variation in families' reports of the quality of care or the adequacy of safety and crisis planning based on youth characteristics, right? So for example, youth who are Latino or Latina or Latinx versus not, did those families systematically have lower or higher quality services than other families? One of the goals of the system is to be culturally competent. Obviously, if people are having lower quality care based on their race or their ethnicity, then we have a problem with our cultural competence. There was not any evidence of differences across race or ethnicity or sex based on the data.
Assuming they were English speaking?
Yeah, assuming, but yeah, I already mentioned that. So that's actually a really big limitation is what I'm looking for. Obviously a big limitation. So that's a limitation, but just those were the analyses we did for that. I'm not going to talk about those things. Last thing I want to say here, I did the same analysis, but again, broke it out by CAN score. This is what I showed you before, where we looked at the collaborative care based on whether a kid had a CANS of 0, 1, 2, 3. On, what do I have it here? On 6 out of 9 of these indicators, the kids with the highest CANS had statistically significantly lower quality of care based on these 9 criteria. So here again, it's not just that one item that we really talked about a lot before. There are 5 other items that are really important that we're really seeing a deficit here as far as our system meeting the needs of the youth and the families that have the most significant challenges. And some of these are really important, like the collaborative care. Arguably, the kids with the CANS of 3 are the ones who the most need providers to be communicating with each other and everybody to be working on the same page. And they are the ones where that's the significantly lowest rating, and they're not agreeing that that's happening.
Well, in the community-based service array. So I would have to say that from a family who has had those 3s on the CANS with the kiddo, that I think there does reach a point that we feel like no one has any answers anymore, and we have exceeded the expertise and availability in our community. If you happen to live in a community that has higher level services, you're great, but if you don't, then oh well. And the irony here is that those kids very frequently end up out of state and no longer in your survey pool. Right, so I would agree with everything you're saying here. That has been our experience. When it comes to lower level services, our community knocks it out of the park. When it comes to the higher level, it is hard to find consistency, hard to get in on availability. And then you don't necessarily have something that meets specific needs, because mental health, it's not one thing.
That's right.
It's not, it's not like putting a cast on your foot and you're like, oh, this is a cast, that's a cast, that's a cast. They're all casts. No, mental health treatment, and, excuse me if I've offended your cast on your foot, but I have to say that mental health, every one of the treatments is very unique and different, which it makes it hard to have a service array that catches all the things. Yep. And when we are trying to discuss all the things with mental health, and especially in our rural communities, it's tough. And that's one of Idaho's biggest challenges. So I can't tell you how much I appreciate what you've told us. We could probably talk about this subject for another 3 hours. And you and I would never get tired of it. I love data, and the geek in me, my engineering geek, loves the data. So we've had a couple of comments, and they basically are saying our high level kids are not getting the services they need, and they're kind of glad that the data is showing that. It gives us a focus. So thank you for joining us. Thank you for being with us today. And we will post we have your slides, and we have your presentation, and we'll go ahead and make sure everybody has access to that on our website, and directing it back to the Youth Empowerment Services website as well. As always, this is one of my favorite sessions because my geek gets to show, and I love it. So thank you very much, Nate. And I look forward to seeing you next year when we come up with how it's going. More data, more fun.
Should be. All right. It was a pleasure. I really enjoyed talking with you.
Thanks. Talk to you later. Bye-bye.
Bye-bye.